Hello, and welcome to the Healthy Aging NC webinar series. I'm Jeanne Dairaghi, Project Manager for the Chronic Disease Self-Management component of the NC Center for Health and Wellness here at the University of North Carolina at Asheville. Today's webinar has several objectives: describing the Healthy Aging NC Resource Center, introducing myself and the Living Healthy Chronic Disease Self-Management Education component, and explaining the services and resources of the Healthy Aging NC Resource Center, especially as they relate to chronic disease self-management and healthy aging. Here at the NC Center for Health and Wellness, we have a mission of developing equitable opportunities that lead to healthy North Carolina communities. We have the ability to work with a variety of partnerships, from nonprofit organizations to clinical medical agencies to academic research institutions. We're able to reach out across the region, state, and nation. We provide services to a spectrum of ages and settings, and we incorporate a results-based accountability approach to the data and outcomes. And as some of the greatest gaps in healthcare and equitable health outcomes focus on older adults and adults with disabilities, the center addresses these issues through funding for fall prevention and chronic disease self-management programs. Currently, the center is comprised of 6 staff, with 3 full-time staff concentrating on the Healthy Aging NC Resource Center. So let's take a moment to explore why the NC Center for Health and Wellness is focused on healthy aging and chronic disease in particular. One of the factors is that the growing age of our state keeps increasing. By 2018, North Carolina is projected to have more people 60 and older than all of the ages 0 to 17. Now, this is important because as we age, we naturally experience a variety of factors, and this includes the likelihood that we will have a chronic disease such as heart disease, diabetes, and arthritis. And in fact, North Carolina state figures show that 82% of people aged 65 and older reported having a chronic condition, while 54% reported 2 or more. Now, we're defining a chronic disease as one in which the symptoms last more than 3 months, it's not cured through a vaccine or medication, and it doesn't just disappear over time. Often the symptoms may require ongoing medical attention, and they may limit activities of daily living. Chronic disease not only affects our friends and family members and ourselves, it's an expensive burden to our state and healthcare system. In just 1 year, it costs over $500 million to treat hypertension, diabetes, and arthritis among older adults. And it costs over $3.4 billion to treat adults with multiple chronic conditions in 1 year. So what can be done? This is where the Chronic Disease Self-Management Program of the Healthy Aging NC Resource Center is working to make a difference. Our long-term vision has multiple facets focused on raising awareness, supporting implementation, and increasing access to proven programs called evidence-based programs throughout the state. This is helping the state move towards a healthier environment with improved healthcare utilization, increased self-efficacy and self-management, and better health status. So I mentioned evidence-based programs. What do I mean by this? Evidence-based programs offer proven ways to promote health and prevent disease among older adults. They're based on research with multiple audiences and settings and provide documented health benefits. These health benefits include reports of better general health, a more positive healthcare experience, fewer hospital and doctor visits, and lower healthcare costs. So these programs allow for more efficient use of available community and healthcare resources, can be easily replicated and shared, and facilitate partnership development and community clinical linkages. In particular, for chronic disease, the center focuses on the provision of the evidence-based programs of the Chronic Disease Self-Management Education Suite of programs, which were developed at Stanford University, and they're branded Living Healthy here in North Carolina. These programs include the Chronic Disease Self-Management Program, or CDSME, which is for participants with any type of chronic condition, Tomando, the Spanish language version of CDSME, and then topic-specific workshops that include diabetes self-management, chronic pain self-management, and positive self-management, which focuses on HIV-positive participants. Results show that after participating in these evidence-based programs, participants demonstrate significant improvements in exercise, cognitive symptom management, communication with physicians, self-reported general health, and so many other things. They also spent fewer days in the hospital and trended towards fewer outpatient visits and hospitalizations. So what exactly does the CDSME suite of programs look like? Well, they're comprised of 2.5-hour workshop sessions offered once a week for 6 weeks, usually in a community setting. People with different chronic health problems attend together, and the sessions are led by 2 trained facilitators. Now, these sessions are not focused on lecturing or therapy, but instead they focus on sharing and practicing self-management topics and tips. Subjects covered include things like techniques on how to deal with frustration or fatigue or pain, ways to exercise to improve strength, flexibility, and endurance, the appropriate use of medication, ways to communicate with family, friends, and health professionals, nutrition and healthy eating, and decision-making and action planning. Area Agencies on Aging, or the AAAs, receive federal funding through Title III funding distributed by the NC Division of Aging and Adult Services to provide these Living Healthy CDSME programs to older adults across the state of North Carolina. Senior centers, health departments, communities of faith, community-based organizations, and more offer these workshops on site. And in fact, since North Carolina began gathering the data, over 1,000 CDSME workshops have been provided to over 11,000 participants. So in order to raise awareness about these effective programs and to promote them, the center maintains a one-stop website, www.healthyagingnc.com, that provides a variety of services. There are descriptions about these evidence-based healthy aging programs on this website. There are Google Maps to help locate healthy aging activities and programs, and even the ability to register for classes online. And in addition, facilitators are able to post their programs on this website, and there are downloadable tools that support healthy aging. This includes items like a disability inclusion toolkit, a continuum of care toolkit for fall prevention and chronic disease, and many more things. There's news and information on healthy aging, and this is also available not only online but on a mobile-friendly format. And we recommend you check out healthyagingnc.com, and we do have plans into the future to be posting more of these training webinars. I have a video gallery, social media link-ins, a referral option, and a resource portal. And also, to help with the availability of the Living Healthy CDSME programs, the Healthy Aging NC Resource Center, in partnership with the Centralina Area Agency on Aging, provides a reduced cost training. It's called Master Trainings through the Training Academy. Master trainers are not only able to facilitate the workshops themselves, they're also able to recruit and train leaders to provide the workshops. The Training Academy also develops resources and service to support the master trainers and lay leaders throughout the state. And this includes items like templates for flyers and promotional materials, sample media items like articles, and assistance with lay leader trainings and retreats. With all of this work going on, it's important to collect the data that shows the impact of these evidence-based programs across North Carolina. This is another item that the center provides for the state, data management. Both our funder, the Administration for Community Living, and the developer, Stanford University, require the collection of 3 forms for each of the CDSME workshops taking place. The 3 forms include a cover sheet with the logistics of the workshop, a participant survey, and an attendance log. These are collected by the lay leaders for each program, and immediately following a workshop, this paperwork must either be emailed or scanned to our data manager for entry into the national database. These forms can be found on our healthyagingnc.com website, and reports using this data are available for grant writing efforts, impact statements, and annual reports. Just let me know if you're interested in learning more about the data in these reports. We're also working on innovative pilot tests here in the state of North Carolina. We are working to reach out and expand services to underserved populations. So some of these test pilot collaborations include our work with the Land to Sky Area Agency on Aging. This focuses on expanding the availability of the diabetes self-management and chronic pain self-management programs, expanding outreach and partnerships with minority populations, such as the African American faith community, and migrants and the migrant education program. And if this interests you, you can find out more about these partnerships online at the healthyagingnc.com websites, where we have spotlights on our work with the Asheville-Buncombe Institute for Parity Achievement and the Migrant Education Program of the Buncombe County Schools. This partnership also works on expanding access in rural populations, including a test pilot with an employer that is providing chronic disease self-management program as part of their wellness services. Another test pilot collaboration is with the WNC Community Health Services, which is a federally qualified health center. And this is focusing on on-site implementation of CDSME as a way to reach out to low-income populations and a diversity of races and ethnicities, and also expanding clinical community partnerships with a closed-loop referral process. Like the other resources, you can find out more about this effort on our healthyagingnc.com website, where there's a focus on lessons learned. We also have pilot partnerships with the Office on Minority Health and Health Disparities, and this includes training opportunities in cultural competence and health equity, and with the Office on Disability and Health, as well as we're working with Centers for Independent Living, Services for the Blind, and Services for the Deaf and Hard of Hearing. So this is all to expand outreach and awareness to those with disabilities, so that there's a better understanding of accessibility and accommodation. So why are we focused on expanding to populations experiencing different forms of disabilities? Well, we've found that as we age, the prevalence of disabilities increases. It's associated with the aging process, whether that's a disability with hearing, vision, cognition, or mobility. And we find that chronic disease can actually contribute to disabilities. For example, diabetes can lead to both hearing and vision loss. Arthritis and multiple sclerosis can lead to mobility restrictions, as some examples. And the prevalence of disabilities can contribute to chronic disease. The Centers for Disease Control shares that adults living with disabilities are 3 times more likely to have heart disease, stroke, diabetes, or cancer. Now, if working with people with disabilities interests you, there is an inclusion toolkit for facilitators on the healthyagingnc.com website with more information on how to specifically work within different populations. In addition, we're focused on underserved populations because race, ethnicity, and income status add another layer of how aging can be adversely affected. Some racial and ethnic groups do have worse health and worse health outcomes than others. And these health disparities do not have a single cause, but many complex and connected causes. And this slide describes some of them: social determinants such as poverty, lack of education, racism, and discrimination. Some conditions in the environment, such as a lack of resources that support physical activity or healthy aging. Particular behaviors like a poor diet, tobacco use, physical inactivity, and then also less availability to healthcare and lower quality of medical services. So for these reasons, the Healthy Aging NC Resource Center does focus on cultural competence and health equity trainings. And as you can imagine, with all of these innovative test pilots and efforts going on across the state, resources have been created to share the best practices and partnerships that have been developed. And we're honored and proud to work with a variety of organizations in the groups across the state. In particular, the NC Division of Aging and Adult Services, the Area Agencies on Aging, federally qualified health centers throughout the state, as well as hospital systems, the Centers for Independent Living that focus on working with individuals with disabilities, NC 211, local health departments, faith communities, coalitions, and more. And we're always interested in learning about and collaborating with others for this important work of healthy aging and chronic disease self-management in North Carolina. So if you are interested in learning more, or you have questions about any of these resources, or you'd like to recommend me to reach out to a particular group, I welcome you to reach out to me. I've included my contact information here along with our healthyagingnc.com website link and Facebook page information. So thank you for being a part of this webinar about the statewide efforts of the Living Healthy Chronic Disease Self-Management Education Program of the Healthy Aging NC Resource Center. Thank you so much.